Hello, and welcome to JA Explained. This episode is all about helping your child or teen with JA juggle the emotional challenges of having a chronic condition like arthritis. My name is Jeanne Proefrock, and I myself am a JA parent. My 13-year-old daughter was diagnosed at age 2 with polyarticular JIA. Our guest today, Dr. Jessica Auslander, will share advice on how we as caregivers and parents can help our kids navigate the highs and lows of having a chronic illness. Dr. Auslander is a licensed clinical mental health counselor, psychologist, and JA parent who has been living with arthritis since age 8. So she understands this topic through and through. Dr. Auslander, thank you so much for joining and welcome.
Thank you very much for having me.
We were just recently in Washington, D.C. doing the advocacy summit. We spent an entire day, hours upon hours walking Capitol Hill. By the end of the day, she's hobbling with her tell, which she wore, her beautiful dress and everything to look very well presented. But then there's, and then she's got her dirty tennis shoes on because let's face it, a JA kid can't walk around in pretty shoes all day. But she was doing her tell where her foot's tipped in and she's up on her toe. And I always know that means I'm hurting. So what's the best way when she's having a tough time like that I can encourage her to open up and talk about what's bothering her, or if she's hurting, or if it's the situation where she's not being chosen, where I'm not prying, but I am prying. I know I am. I'm a parent and that's what we do. But how do you open it up and encourage them to talk without making them feel like you're prying? And when is it time to just know it's enough, stop asking the question and let her be and let her handle it?
Yeah, we always want to keep the door open, right? We always want to say, hey, if you ever, please, I'll drop everything, right? Our kids tend to know that about us at this point. But you can also, you want to give them space to make that decision for themselves. So you can give them the feedback. You can see tell them what you see and then let it go. Hey, I noticed the limp. Do you need anything? Not, are you okay? Do you need anything? Right? What do you need right now? You want them to own it because they're going to have this body their whole life, right? They're going to have this body their entire life. When we get to, okay, I know something's going on and they're not talking to me, it's okay to take that a step further, especially with, I think, middle and high schoolers, even some of the older elementary, and say, okay, I'm noticing this. I'm fine. Leave me alone. And you can say, I'm going to leave you alone. But when I see you in pain and you won't talk to me, it gets me too. It's okay to start to let them in with how this affects you, because one, they need to start seeing parents as human beings, right? When they're little, we're these magical creatures. It's great. But when they get bigger, they need to realize that we're people and we respond when they bite our heads off. So the example I give with my son, I watched him for months struggle and I was kind of letting it play out. This is just how he works best, is he needs to figure it out on his own first, even if he learns the hard way. And he switched from having me go to his appointments to his dad. Okay. So dad was going to his appointments, and then started to slide into the chores weren't getting done. He was tired all the time. He was isolating in his room a lot. So then I'm on my phone turning off the internet just to see what would happen, if he comes downstairs or not, right? I'm looking at other behaviors first. And then we had that conversation. And he was like, I'm fine, I'm fine. He's like, why won't you let me just take care of myself? And that's when it opened the door for me to say, I've watched you. Here's my observation. If I can give you, I kind of ask permission with my teenagers, my older teens. Can I give you some feedback? Right? They may not be in the place to hear it. Can I give you some feedback? Sure. Okay, I've just noticed this slide. You're struggling more, you're tired. The backpack's getting dropped at the front door, not getting carried upstairs. These are the things I've noticed, and it just makes me a little nervous and makes me worry, which distracts me. And then he was able to say, yeah, okay, I'm starting to think that, my medication's no longer working. He'd been on the same biologic for over 3 years. So, it's like, I'm starting to think that it's time for a change, but he just wasn't ready to tell me yet or to have that conversation. Totally fine. But it was okay for me to give him a little bit of, this is what I'm seeing. This is how it's affecting me. I keep bringing it up because I'm getting nervous. I see it get worse. When you're living, growing up with this disease, you don't always have the best insight. So growing up, my disease started in my right ankle, and it did not go bilateral till I was in high school. And back then, a few rheumatologists told me that it couldn't be arthritis because it was only one joint. I know, such a different world now. So they couldn't figure it out. And I didn't realize a certain way I would kind of hold my body or a certain way I would walk. And that just became how I would naturally adapt because I was not about to slow down. I was in color guard too. I was not going to slow down. So I didn't realize it until my mom or my dad would go, "Hey, you realize you're limping. You see this, right? Or I've watched you and like you're not using your right arm." And I would not even notice because my body is so used to it. So you can give the kids the kind of the objective feedback, ask, "Hey, can I give you some feedback?" See what, tell them what you see. And then if they're still kind of resistant and they don't want to talk or open up, it's okay to let them know, "Hey, when you're just let me know so I stop worrying." It's okay to let them know how you feel and how being a caregiver, affects us too. They need that little bit of humanity because you're also modeling how to talk about your feelings. You're also modeling boundary setting.
You need to encourage them as they grow up and they hit their teen years to be independent. But especially if you're a parent of a child that was diagnosed so young, like at age 2, you've spent all your life protecting and in watching out for them, etc. So let's go into a situation like where we're at right now. I have a 13-year-old in color guard with the high school group. She is actively flaring. She is hurting, but she won't stop and take a break, even though others see her hurting. And it's not mom and dad saying something because we're obviously not at these rehearsals with her every day. But she's pushing so hard that she's actually scaring her instructors and coaches. I try not to be her advocate anymore. I allow her that ability to be her own advocate. But then your coach is telling you these things where you're like, "Ooh, can my child actually injure herself because she's pushing too hard?" At what
Yeah.
point do you? How do you make that separation or find that balance as a parent and allowing them to be independent, but yet still protecting the physical body that they could cause harm to?
It starts with a conversation with a physician, because every arthritis is different. So that conversation is going to be different for everyone. So we always start with the medical professionals, get their guidance first. And then it's helping your kids learn their own bodies. So the younger kids, again, they're not going to really know the difference between the types of pain until they get older. The middle and high school kids, they know the difference between a growing pain or I took a step funny on my non-affected foot versus my affected foot. They're going to have more insight. I always like to put it in the kids' words. So we want them to be their own advocates, right? They also have to learn how to explain this to people, right? They have to be able to learn how to teach others not to be concerned. We don't want those well-meaning other adults in their lives to overprotect them and then bench them. And then we have a whole other situation. So my kids are younger and people would ask me those questions. I would answer with, "Well, my child has told me that this is okay and this is a problem." I could be completely giving them my words and my take on it. But by starting it with "my child told me," I'm also telling that adult it's up to my kid. It is up to my kid. With my kids with band activities, for example, their swelling will be in their hands a lot because mallet work, right? They're holding multi mallets in their hands. It's a really unnatural grip. And I've explained to their directors, they might sit and that's their form of resting, but let them self-regulate. That's my word. I'm going to let them self-regulate. The only accommodation you need is that they need to sit or get water or get an ice pack. You don't draw attention to it. Let them run their own show. While you're having the conversation with your child, here are the rules. You can self-regulate, but we need to know when you're pushing yourself into the danger zone, right? If you're forcing yourself to run on a joint that is talking back to you a little too much, hey, just so you know, you can make this choice. This is a choice you can make, but the consequence could be this, this, and this.
On the other side, when the child goes through that challenge and you say, "Here's the consequence," I think if you're also talking about being cautious to not use everybody's favorite words, "I told you so," when they hit the consequence. I mean, I'm assuming that's also something that as a parent, we have to be super cautious about not doing.
So I love the phrase, "Did that surprise you or was that unexpected?"
I like that.
My
I like
kids have
that.
now totally figured out that's me saying I told you so. But, now they're older and I can say, oh, look, it's a consequence of your own actions.
Yeah.
Um, but say, okay, was that unexpected? Is this what you thought would happen? Now that can also open up a great conversation of no, because I didn't feel that pain until.
Okay.
Or, yeah, I could sense I was getting tired and I decided to push it. It's all about developing insight, any kind of chronic illness. It's about insights. We talk about our kids growing up faster than other kids. And as parents, we want to kind of mourn, oh, their childhood was shorter. They had to deal with things. Actually, I look at it as, oh my gosh, I skipped so many levels of parenting on that one because my child did the work themselves. We want them to develop that insight into their body because that connection with their body is going to serve them in other areas of growth and development. They're going to know more when they're sick, right? When something is changing in their bodies through puberty, right? If there's something is wrong, they're going to know their bodies better than someone who doesn't grow up constantly getting internal signaling, getting those pain cues or getting those inflammation cues from their body. So I'm okay with it. I'm going to have those conversations to help my children develop the insight into their body. I've gotten into arguments with my 17-year-old saying, look, my arthritis is not the same as your arthritis. It's the same on paper. And your doctors ask you about me because of family history. And they want to know what works for me because it might work for you. But at the end of the day, your body's not my body. The kid's got almost a foot of height on me. He had the growth spurt. I did not. So you have to learn your body and it's your responsibility to take care of it. That might mean telling me something's wrong. That might mean taking a break. That might mean talking to your doctor. He's 17, a senior in high school. His doctors are starting to work with him on transition and having conversations with him outside of me, which is our goal, which is what we want. It's still your responsibility. There are days they're going to take that on and feel empowered. And there are days that they're going to crash and burn. And as parents, there is value in sitting back and letting them experience that process because that's how they're going to learn best. Now, obviously, if we've got very visible joint damage, inflammation, if there's a safety issue, we're still going to step in. And raising a child with arthritis, if we don't want them to have the anxiety and the fear and the depression that can come with it, it's not a guarantee. We want them to develop that insight, that self-awareness, and that empowerment that they have the tools they need or they know where to get the tools that they lack.
So then you have these open conversations and you have these nice dialogues, but at what point, say they're not feeling the independence and they're actually going the other path and it's kind of a little bit darker and they're feeling the sadness and the overwhelming weight and maybe they're talking to you, maybe they're not. When do you seek help and where do you go with that? What if your child doesn't want to go? Because obviously they're not having the conversation with you. And now you're saying, I'm noticing this or I'm seeing that. Maybe we should try this. And they say, nope, I'm fine. How do when do you know it's time and how do you encourage them to engage in that process?
I like to introduce it when they're younger. So introducing that as this is someone who could be on your team, right? We talk about doctors and nurses and maybe physical therapists. Maybe there's occupational therapists involved, right? So having the conversation when they're younger that, hey, there's all these people that are on a medical team. And, what a therapist does is they help you figure out how to make decisions. They help you sort out how you're feeling, right? Very basic. If they don't want to go, we do not force. We do not force. I might gently point out that, hey, you're choosing to sit with all of this pain. We do have options. One option is therapy. What are some other options? And see if they start talking. My kids during the pandemic, we were a big fan of our local rage room where you go into this environment where you can throw stuff against the wall and hit stuff with the baseball bat and just get it out. That can be very therapeutic. One of my children really leans into art, right? And she will paint her pain. She will do things like that. She expresses herself through art. So it's finding some outlet. If they're resistant to talking to somebody, that's fine. You always leave it on the table. but say not getting it out is not an option, right? Encourage a different outlet for them. But I love, introducing the thought of therapy or just talking about it before they actually need it. It can be a very powerful tool. You can also go as a family and not even talking about the JA stuff,
Right.
right? Don't look at it directly. You can go as a family and just talk about how do we communicate better? How do we function better? And you don't even have to mention it. And most of the time, families tell me the JA child brings it up and opens the door once they feel safe.